السلام عليكم ورحمة الله وبركاته أعزائي الطلبة. Today's lecture is lecture 3, which is pain control and endodontics. So you will understand pain in endodontics, and hopefully you'll be able to manage pain using different approaches and be able to apply different local anesthesia techniques. الpain هو unpleasant and distressful body sensation, and this is occurring often due to injury or disease. And pain control in endodontics, though it's not very difficult, but sometimes it becomes almost impossible to control the pain. So you have to be aware of the different methods to manage the pain. So any stimuli to the teeth will be transmitted via afferent nociceptive, or nociceptive means, sorry about that. Sorry about that. So any noxious stimuli in the teeth will be transmitted via primary afferent nociceptive. Nociceptive means pain detecting. So these pain detecting sensory neurons will transmit the pain. So through these neurons, through the nerve fibers إلى الtrigeminal ganglion. Okay, as you can tell, the trigeminal ganglion or trigeminal nerve is divided into the ophthalmic, maxillary, and mandibular branches, and through the trigeminal ganglion, these stimuli will be transmitted and felt as pain. So sensory stimuli, whether that stimuli is thermal, mechanical, or chemical, or electrical, okay, these afferent impulses from the pulp tissue generally results in pain sensation. So we have two different type of fibers, actually three, like, we have the A delta fibers and C fibers. There's the beta fibers اللي هي more associated with the sensation of light touch and the pressure, but here we will be discussing A delta fibers و C fibers اللي هي يعني أكثر associated with the transmitting pain. A delta fibers الدلتا fibers هي myelinated and covered with an insulating layer, and that makes them longer and faster in transmitting the signals, and they are primarily located near the dentine pulp complex. يعني هي تمتد داخل الدنتين يعني associated within the cell process of الأودونتوبلاست within the dentinal tubules. وهي أكثر شيء تنقل لنا الsharp instant and intermittent pain. So when you bite into something, whether that's cold or hard, that sensation of pain هو اللي تنقله هي الدلتا fibers. The C fibers here located more centrally يعني in the pulp tissue, وهي تختلف عن الدلتا fibers بأنه هي unmyelinated and they are smaller in diameter and transmit signals more slowly. Okay, so they are responsible for dull aching, burning pain, which is often continuous and occur in deeper dental tissues, or inflammation. C fibers هي تكون عددها more numerous than the delta fibers, and they are present at about 3 times higher in number, عددها 3 times أكثر من الدلتا fibers. هذه مقارنة أوكي حتى نعرف نشوف الستيمولي هذا السنسيشن اللي تنقله أو كل fiber responsible for it. يعني مثلا إذا نشوف الدلتا fibers هي أكثر شيء transmit الكولد، الهيت، ion effect، electric pulp testing، أوكي، hyperosmotic solution، بينما C fibers تكون more responsible for sensation of heat and in case of sensation of pressure in case of pulpal inflammation, pulpal pressure and in the presence of the inflammatory mediators. هاي حتى نقدر نفرق بين الاثنين. طبعا اكو شيء اسمه ال pain threshold أو the pain reaction threshold, and this is the point at which the patient or a person feels the pain. And specifically in endodontic therapy, there's a hyper response to stimulation that is significantly increased. So managing the pain is mandatory, okay, and um, being able to manage the pain is mandatory. Why do we have to control the pain in endodontics? We have to control the pain because when the sensation of pain increase, the blood level of catecholamines, so this is more like, we're looking at it from a biochemistry point of view. شي يصير تعرفون بفايت أو في حالة الفايت أو flight response أجسامنا تفرز هرمونات. So مثلا الكاتيكوكولامينز يرتفع مستواها بالبلد، وهذا يزيد مستوى البلد بريشر والهارت ريت. اوكي. فهي من كستريس هرمونز مثل الادرينالين والنور ادرينالين او الدوبامين اللي هي released by الادرينال gland. They will increase the blood rate, blood pressure والheart rate. اوكي، حتى support حالة الفايت or flight response. ولذلك هذه الحالة طبعا البين ممكن يؤدي إلى fainting، ممكن يؤدي إلى attacks of angina أو asthma أو psychiatric reaction. So you have to be able to manage and control the pain. And in order to reduce the possibility of such condition happening, anesthesia has to be introduced slowly and in supine position, okay, so that it's not painful. And correct diagnosis of the etiological factor of pain and proper treatment of the problem to relieve pain in many cases. طبعا إذا نريد نسأل نفسنا سؤال، شنو الطرق اللي نقدر بيها نسوي management للpain؟ okay, there are mechanisms for managing the pain, and the first mechanism is blocking the nociceptive impulses along the peripheral nerves. So how do we block the impulses? We can do that by local anesthesia. Can be achieved by applying local anesthesia, so the impulses will be blocked, or reducing the nociceptive impulse from the site of injury, as an example, when we prescribe analgesic like the non-steroidal anti-inflammatory drugs. And we can الطريقة الثالثة preventing the pain perception in the central nervous system by combination of an NSAID and long-acting anesthetic agents. فالأنستيزيا اللي تستخدموها دائما هي تكون medium أو short acting. medium acting مثل الليدوكاين، لكن بعض أنواع الأنستيك تكون long acting. الإفكت مالتها ممكن يستمر 10 ساعات أو 8 ساعات حسب وجود vasoconstrictor or not. اوكي، فهاي تستخدم ممكن في حالات مثلا ال patient undergoing surgery أو there is inflammation. اوكي، أو there's acute inflammation. هاي ممكن تؤدي in combination ويا الأنستيك راح تقلل ال pain significantly. اختيار analgesic. Okay, so mainly you will be using non-steroidal anti-inflammatory drugs analgesics. Of course you can use the opioids اللي هي also analgesic, but you have to be aware of the side effects of the analgesics and of the opioids. For instance يعني لو نعرف احنا الأوبويدز مثل أدوية مثل المورفين، الكودين، اوكي، او الترامادول. هاي ادويه هي اوبويدز انالجيسك اقوى وبس بيها سايد افكتس. اوكي، سو هاي السايد افكت مثل sedation, constipation او respiratory depression, nausea, vomiting الى اخره. You have to be aware of the side effects of these medications. Okay, and you have to also make sure that the patient is not taking any other medication that could interfere with these analgesics. So you mostly will be using non-steroidal anti-inflammatory drugs. وهنا مثل road map شو وقت توصف which type of analgesic. So in the أول حالة, if you have mild to moderate pain and with little inflammation, you can prescribe paracetamol or low dose ibuprofen. And if you have a patient with a history of asthma, and you can also prescribe paracetamol or namisolide. And if you have acute short last but short يعني short lasting pain مثلا, هذا يضمن أيضا ب post extraction ممكن you can prescribe ketorolac, ibuprofen أو diclofenac. إذا البيشنت has gastric intolerance to NSAIDs, then you can prescribe either itrcoxib or paracetamol. And in case of pregnancy, you have to be aware also of side effect of many medications. Safe analgesic would be paracetamol. في حال patient have other systemic disease like they are hypersensitive with diabetic or ischemic heart disease or has or epileptic or any other or patient receiving long-term regular medication, you have to consult the physician and consider the interaction of their medication they are taken regularly with with the NSAID. Okay, now let's talk about the local anesthesia. So we've spoken briefly about the analgesics. Let's talk about the local anesthesia. And local anesthesia here with agents that will result in temporary loss of sensation of pain, okay, in certain parts of the body. This is produced by topically applied injecting agent without depressing the level of consciousness. So we can apply local anesthetic in a local area without depressing a level of the consciousness. And it can prevent the pain during dental procedure and eliminate the fear and anxiety. You have to be aware of the anatomy of to prevent problems that can occur during the anesthetic injection, and these problems such as the muscle trismus, hematoma, and intravascular injection. Okay, so proper knowledge of anatomy is mandatory to avoid complications. And as you can tell by now, you've learned that probably since year 3. And this is a reminder that the local anesthetics can be classified into amides and esters. And in the esters group, we have long-acting agents or long action like tetracycline. We have short action like a procycline. We have surface action like benzocaine or cocaine that we use as topical um, anesthetic before that we use before injection. And we have the amide, which is the medium action lidocaine that is you use most commonly, and you have long action like the bupivacaine and ropivacaine, and these long action anesthetic that we mentioned earlier that can be used in cases of if you want to like a prolonged pulpal analgesia. So how does the local anesthetic work? The primary action of local anesthetic agent is that they decrease the nerve permeability to the sodium ion. So you know the action potential and the transmission of the sensation or of pain. You have sodium, or you have what's so called voltage gated sodium channels, and they are responsible for transferring the sodium ions, and once they are transferred through the nerves, then you get conduction of the stimuli through the action potential. And what local anesthetic does is that they block these voltage gated sodium channels and thus prevent the transmission of the sensation. The local anesthetic contain they contain vasoconstrictor because without the vasoconstrictor they cause vasodilation, and they can be transferred to the bloodstream and الإفكت يكون toxicity. لذلك vasoconstrictor are added to the local anesthetic agents and so that they can narrow blood vessels or cause constriction, and they slow down the absorption and prolong the effect and reduce toxicity and limit bleeding. There are special considerations that you have to be aware of and consult the physician before injection or before injecting local anesthetic with vasoconstrictor. And these conditions هي الhyperthyroidism, cardiovascular diseases, diabetes, and those patient with certain medication. Okay, like the MOA inhibitors and tricyclic antidepressant. Why local anesthetic fails in infected tissue? In case of an infection, so in normal tissue ال pH بالnormal tissue in our bodies هو 7.4. In case of an inflammation ال pH راح will fall to probably 5 إلى 6. Okay, and this low pH طبعا we know that the anesthesia is alkaline. um, it will not due to it will not be transferred due to the presence of the acidic media. So there will be a reduced nerve sheath penetration by the anesthetic agent, and that results in poor anesthesia. So there's also a risk of spreading the infection when we insert the needle. Okay, so in these cases, if you have inflammation, you may want to consider an alternative anesthetic technique like the nerve block. Okay. Once you have administered the local anesthesia, how do you confirm the anesthesia? You don't have to use the conventional methods, okay? You can check by electric pulp testing, okay? Topical anesthetic agent are very beneficial. You can use these topically applied agent to the site of the injection before administering local anesthesia, and they are effective to minimize the surface discomfort of the injection. And they usually composed of benzocaine up to 20%, or lidocaine solution, ointment 5%, or spray up to 10%. Okay, and now we will discuss the techniques of local anesthesia, and the first the technique for inferior alveolar nerve block. السايت of deposition هو يكون near المانdibular foramen before the entry of the inferior alveolar nerve. And this technique will anesthetize the mandibular teeth on this injection site, and the lingual nerve can also be anesthetized in the same injection with its innervated region اللي هي lingual mucosa and the tongue. However, the buccal mucosa cannot be anesthetized in this injection. So you will be administering a conventional inferior alveolar nerve block to a symptomatic patient. Usually your cartridge contains 1.8 ml of 2% lidocaine with 1 إلى 100,000 epinephrine, and that would provide you with pulpal analgesia for 15 minutes. Within 15 minutes for pulpal analgesia will last for 1 hour. Sorry. طبعا research have found that administration of 2 cartridge volume was significantly better for avoiding missed block. So usually خلي ببالكم بأنه أنتوا تحتاجون 2 cartridge حتى تضمنون success of your inferior alveolar nerve block. Okay. Not only inferior alveolar nerve block، عندنا تكنيك ثانية هي mandibular nerve block اللي هو الثيرد برانش من الترايجيمينال nerve. Okay, so a nerve block to that will anesthetize all mandibular teeth in the region with the buccal and lingual soft tissue, and it will also provide sensory anesthesia of the buccal and mylohyoid nerve. And in the most cases, mandibular nerve block should be combined with inferior nerve block to ensure pulpal anesthesia. So you've got 2 techniques for the mandibular nerve block: Gauge and Akinosi-Vazirani technique. So the first one, Akinosi-Vazirani technique, here used when there is limited mouth opening, and that would assist with the mouth opening. On the site of injection هو الهايت of الموكوgingival junction of الماxillary third molar قريب الماxillary tuberosity. Gauge technique تختلف بأنه you will be performing that when a patient is lying down in supine position and the mouth is wide open. The dentist aims to administer the local anesthetic just anterior to the neck of the condyle. يعني anterior للneck of the condyle. Okay. قريب للmandibular branch of the trigeminal nerve after it exits the foramen ovale. Okay, so and the fourth technique here, incisive nerve or mental nerve block. The site of الانجكشن هو بين المانdibular two premolars. This anesthesia that would provide anesthesia to the lower lip, buccal mucosa, skin of the chin, ventral to the mental foramen, and in addition to the premolar and anterior teeth in the region. As for the maxillary anesthesia, the techniques for maxillary anesthesia, the most commonly used injection for anesthetizing maxillary teeth would be infiltration technique, here infiltration with cartridge of 2% lidocaine with 1 إلى 100 ألف epinephrine. So 1 to 100,000 is the percentage or the ratio of concentration of epinephrine within that agent. Infiltration results in a fairly high incidence of successful pulpal anesthesia, around 87 to 92% of the times. Okay. Pulpal anesthesia usually occur within 2 to 3 minutes, which is fast compared to lower anesthesia. However, the duration of pulpal anesthesia here a problem with the maxillary infiltration. Yani you have to bear that in mind. If you are doing an anterior, for example, root canal in an anterior tooth, you have a pulpal anesthesia that would last for 30 minutes. So after 30 minutes, you have to consider maybe another injection. While in a premolar region, 40 to 45 minutes. Okay, so you need additional anesthetic, administering an additional anesthetic depending on the duration of your procedure. You don't need to do usually a nerve block with maxillary teeth because block anesthesia for maxillary teeth, like including posterior superior alveolar, anterior middle alveolar, palatine anterior superior alveolar أو infraorbital and second division nerve block. كل هاي التكنيك هي كل هاي nerves أو block for these nerves is not required for routine restorative and endodontic procedure. And this is an illustration or image of the trigeminal nerve branches so that you can go through them and refresh your information and your anatomy. In addition to the local anesthesia technique that we mentioned, we've got supplemental injection technique اللي هي تكون مفيدة when you can't achieve anesthesia by the previous you can't achieve pulpal analgesia by the previous techniques اللي هي periodontal ligament injection, intraosseous anesthesia and intrapulpal anesthesia. Periodontal ligament injection, high technique usually is used when no other technique can be used. It can induce local anesthesia in either maxillary or mandibular teeth. A needle will be usually inserted in a tooth with periodontal ligament with a bevel toward the root. Add anesthetic solution of around 0.2 ml is placed per root. The onset of anesthesia here immediate, but the duration here variable. طبعا هاي التكنيك تتطلب هاي بريشر للانجكشن، في يعني ما راح تستخدم السرنج اللي you usually use. There are syringes specifically يعني مخصصة لهذا الغرض. اوكي، مثل هذه الشركات Peri-Press-Pen أو another one is ال STA single tooth anesthesia as you can see in the picture هي مخصصة for BDL injection. Intraosseous injection هي the second supplementary technique. هي particularly useful with the inferior alveolar nerve block when it's likely that supplemental anesthesia will be necessary. اوكي. أم، مثلا في حالة انه for instance you do a root canal for a mandibular second molar. اوكي this is Tabident هو مثال على فد device you can by which supplement intraosseous injection. والintrapalpal anesthesia هي third supplementary technique. Okay. So you just administer the anesthesia. Once you finished your access opening, then you administer your anesthetic intrapapularly. But this هاي ممكن يكون painful. Okay, because you're directly going into the tissue. And the duration مالتها ممكن تكون 15 to 20 minutes. So short, you have to do access opening quickly. There are also you have to be able to be able to identify a source of pain, because in when you're diagnosing pain, usually orofacial pain specifically, you can have referred pain. So most of oral and dental pain usually can be traced to their sources if you're using if you did your assessment, if you did your diagnosis and used radiograph, usually you can trace the source of the pain, but some cases you have referred pain. Okay, especially إذا البين usually experience away from the side. ممكن in the other jaw, ممكن بالears or eyes or sinus if the patient has sinusitis. Okay, so you have to make sure that you're making the careful diagnosis that would reveal affected tooth or related anatomic structure and non-dental pain. Thank you very much, and I wish you the best of luck.